92.7 WOBM. Good morning, Sean and Sue with you. Of course, we continue with Heart Month. February is Heart Month. Joining us right now is Dr. Brett Sealove, cardiologist for Meridian CardioVascular Network. Good morning, doctor. Welcome to the program.
Good morning. Thanks for having me.
Hi, Dr. Sealove. I like that. You could work on my heart.
Anytime.
With that
Hopefully
name.
never, but anytime.
All right.
You know, speaking of hearts, what is heart disease? I mean, it seems like such a broad term with so many different things. I mean, how would you describe heart disease?
Yeah, it's a challenging question. It really encompasses numerous problems of the heart and blood vessels within the body, many of which are really related to a process called atherosclerosis, which is a fancy term for which essentially means building up a plaque or cholesterol buildup in the arteries. And as a result of that process, the arteries become more narrowed over time and can actually form a blood clot in these arteries, which is the leading cause of stroke and heart attack in our country.
If you don't have any issues or any family, history of heart, should you still get your heart checked at a certain age or start early, or what should we do?
Yeah, I mean, I'm clearly a biased source to ask that question, but
Sure.
But I would argue that everybody's at risk. Everybody's risks are different, but everybody's at risk. Heart disease and cardiovascular disease is the number one killer in the United States. It kills about 800,000 people yearly, and every 30 or so seconds, somebody's having a heart attack as we speak. So we've been doing this for about 2 minutes or so. So 6 or 7 people have already had a heart attack while we're sitting.
Wow.
Here. So everybody really
Look at it
should
like
be
that.
very proactive about their health. I don't think it's ever too early to start that process.
Okay.
And depending on your risks, I do believe that you should probably at least seek medical attention, bring it to your attention of your physician, and if need be, to see a cardiologist over time.
Let's talk about blood pressure. Everybody knows somebody who's on blood pressure medicine now, it seems like. Let's talk about blood pressure and how it's treated.
Yeah, so blood pressure, otherwise known as hypertension, measures the force of blood pushing against an artery wall. And over time, that elasticity of the wall becomes a problem, and it becomes its own disease process. It becomes hard and actually can accelerate that process I was talking about earlier about is hardening of the arteries. So uncontrolled hypertension or high blood pressure is actually known as the silent killer because a vast majority of the people don't know when their blood pressures are elevated. So being proactive, again, about seeing your physician, getting your blood pressure screened is part of that process. But treating this, the by far and away the foundation of treatment of high blood pressure and many of the things that cause cardiovascular disease is lifestyle modification. It is essential. It is the framework, the backbone, shall we say, of treatment. And that includes a better lifestyle, better eating habits, healthy weight, managing stress, no tobacco, complying with medications if it's needed, and drinking modestly if that's what one desires.
Yeah, I was going to say, I mean, we have smoking, drinking, weight, probably the 3 biggies, and fourth, maybe exercise then.
You got it.
All right, and that can all help to keep that blood pressure down. If we do all those, we shouldn't have a problem, should we?
Well,
theoretically.
I don't know. Can you say that, doctor?
I mean, if you're watching your weight, if you're not smoking, if you're not, drinking all the time, and you're getting plenty of exercise, wouldn't you say your chances of better blood pressure are probably prevalent, right?
Yeah, I would answer that a different way. I would tell you that trying to modify the things you can modify is what we all should do.
Okay.
Irrespective of that, there's still an element of underlying risk, but the things that we can modify as we move forward step by step in life are things that really we should try to challenge because it is such a prevalent disease that if you do the right thing and live life, to the fullest, but do things in moderation, it gives you the best chance of moving forward.
So you just want to go out and party. You don't want to...
Pretty much. I just want to share with you that it is National Wine Day today, okay? A lot of our listeners love the wine. 1 glass of red wine at night, is that okay?
Yeah, so this has actually been studied and validated predominantly from our European colleagues. So the Mediterranean diet is probably the best diet, I would probably argue, and it really focuses on less red meats, chicken, fish, good oils, nuts, and part of that diet, that's why I mentioned it, is a glass of alcohol, typically 5 or so servings a week. What I tell my patients is that said, if you don't drink, now's not the time to start drinking. But if you do drink and you drink kind of modestly, it is probably, to our knowledge, a relatively healthy thing for your heart, for your cholesterol, etc.
in moderation, though.
You got it.
You don't
Right.
need to be getting drunk every night, Sean.
Thank you.
Definitely
That's
not
what
endorsing
Dr.
that.
Sealove says. I love that name. Dr.
Tell us a
Sealove.
little bit about the Meridian CardioVascular Network and how it offers residents of Monmouth and Ocean counties various items for their health.
Yeah, so the Meridian CardioVascular Network offers a highly advanced, personalized cardiovascular care that I would tell you that probably rivals a lot of other programs and systems in the state and really nationally. It has an advanced experts in heart and vascular care and offers an individual with very different forms of heart or vascular treatment, ranging from diet, exercise, screening, and treatment protocols that really vary individual to individual, but again, really rivals other major national programs.
Very good. And if you want more information on angio
great.
screening and other items, you can go to meridianhealth.com. It's a great source to go on the web, right, for all the information you need.
You got it.
Excellent, excellent. So, Sue, exercise, all right, less booze, and more sleep, maybe. Sleep's also another
I'm sort
thing,
of
I'm
failing
sure
at
that,
this, doctor.
Definitely.
Our schedules, we have the worst sleep schedule of anybody. In fact, I was just dealing with AFib not that long ago.
Yes.
And I think the doctors that I spoke to,
scary.
with Meridian, by the way, told me that my sleep habits may have played a huge part as to why I went into that for a short period of time and then, so forth. So
Absolutely. Everything from poor sleep hygiene, sleep apnea can clearly predispose you to heart disease, especially irregular heart rhythms like atrial fibrillation. So absolutely.
we have terrible sleep. Sue will nap, right?
I'll
Take
nap.
a couple of hours in the afternoon, then
Yep.
we'll get back up, then we'll go back to bed, then we'll get back
Yeah.
up. So,
Yeah.
it's crazy. Dr. Sealove, Dr. Brett Sealove, thanks for coming in today. Sue, should I let you say that?
That's okay.
You want to say goodbye, Dr.
you do.
Brett?
Bye, Dr. Sealove.
There you
See,
go.
notice love.
Thank you for having me.
Sorry.
It is American Heart Month,
Thank
and we
you
want to
so
thank
much.
the friends here at Meridian and their cardiovascular network. Go to meridianhealth.com for more details.
Also, we've teamed up with them. Log on to WOBM.com for all the information you need to know to keep your heart healthy.